Kimberly is a PhD student at the economics department. She's done a lot of important research on many projects over the years, but she's particularly interested in child rights, child protection, and equity in health. So let me welcome Kimberly. And she's going to be talking about NCD interventions and the socio-economic environment in terms of equity.
Hi, good morning. I don't know about what Dr. Bailey just said there. I may always have an answer. I don't know if it's always right. Today, my presentation, I will be looking at the issue of equity within the context of NCD interventions and the socioeconomic environment. So I will start off by saying I make no promises. Essentially, what I want to do is broadly examine the issue. I'm actually hoping that my presentation would generate more questions than answers at this point, and encourage persons to think through these issues a bit more. Okay. So just a note here on sustainable development and health. This quote is from Alain et al., 2013. Health is both a result of and a contributor to sustainable human development. This puts within the context of a quote here, a famous quote that a lecturer of mine would often tell his students, provides us with a bit of context, that good economics begins with a concern for the conditions under which people live. So when we're talking about sustainable human development, the focus there has to be with ensuring that these conditions improve over time and ensuring that health is at the center of that process. Now, when we're talking about health and the socioeconomic environment, over the past day and almost a half or so, we would have heard a lot about the social determinants of health. And this quote here from Beckford, 1972, highlights the fact that in essence, what we're really looking at, a lot of these outcomes, these health outcomes, are the result of behavior. Now, his quote relates to economic behavior being the result of this complex interaction between social, cultural, psychological, and other non-economic variables. And taking it a little further, is by no stretch of the imagination, we could see that it also can have an impact with regard to health behavior. This presentation is partially based on work that I am doing for my thesis. This was partially part of the introduction. And in doing the research, you saw all this information about the gradients, the Black report, all these sorts of things. So this gradient is well established. A lot of times when we see, we read, we hear things, a lot of the information is based on developed countries. While there's a lot of research on the socioeconomic status and health and the interplay there, a lot of it is based in developed countries. That's the reality we are working with. However, that's not to say that we don't have research going on in our region. We have research there you'd notice for Barbados and Jamaica, where you've seen hints of this association over the life course with lifestyles there. Now, this is the conceptual framework for action on the social determinants of health. This more or less in a snapshot, captures most of the literature on socioeconomic status and health. The heart of the framework is the acknowledgement that the socio-political context, the policies of the state, what are policies with regard to education, all of these create socioeconomic position. And this socioeconomic position, where I fit in society, affects what my material circumstances are in terms of where I work, where I live, and by extension, what I can and cannot do. And as you see, there's a feedback loop there with equity and well-being back into socioeconomic position. So sometimes through the interactions there, where persons are at can be reinforced just by virtue of being in that particular situation. Now, looking at non-communicable diseases, I think by now we would have heard a lot about NCDs, the programs, the four major NCDs that are focused on. Emphasis has been given to the modifiable behavioral risk factors. And so you'd have a lot of interventions based around those risk factors there. Now, when we're talking about the issue of equity, this is a definition that kind of is my favorite, particularly the latter part, because I just feel that it gets to the heart of what we're talking about when we're talking about equity. Equity in health means equal opportunity to be healthy for all population groups. So within the context of NCDs, when we're talking equity, it means that everyone should have that opportunity to not have an NCD, or if you already have one, that they should have that ability to care for their needs and manage the disease. Additionally, since the notion of equity is one grounded in justice and fairness, inequities in health most often are referred to as those differences in health outcomes that are unnecessary, avoidable, but in addition are also unfair and unjust. In looking at, again, this issue of equity, in the literature, you would see that the concern with socioeconomic status and health is a life course concern. It isn't a snapshot where we look at persons at the point where they have an NCD, or at the point where we make an intervention and to prevent them from developing one, but it's something that is managed throughout the life course. Because one of the things in the literature is that the opportunity sets, the socioeconomic environment impacts persons pre-birth. You're born into a particular situation in terms of the physical environment and your material conditions. So in articulating interventions, is always important to look at the life course approach within the context of equity as well. Now, I am in the Department of Economics as a PhD student, and so this is the framework that I would be looking at things from. Now, individuals make choices. They make decisions. These decisions are, yes, informed by preferences. We are taught that. But they also make these decisions with constraints. They would be making health-related decisions based on what they can or cannot do at that particular point in time. Okay. When we're looking at equity, oftentimes we would look at health outcomes, and we would look at ways that we could help persons have access to medical care. But what I'm saying here is that access is a very important determinant of health. Health outcomes are very important. But what we need to pay a bit more attention to is the process through which these health outcomes are attained, and whether persons are really able to do what needs to be done to attain good health and maintain it. Now, there are a range of interventions offered at the international and regional level, country level, different types of interventions, both from the level of the state and the level of the Ministry of Health. And a lot of time and effort and planning has gone into these interventions and the execution of these interventions, and a lot of money as well. So the question that would usually arise is, will these interventions have success? And the answer, as an answer I guess economists tend to give, is that it depends. When we look at the interventions and we look at the NCD outcomes, because NCDs tend to be focused a lot on lifestyle choices and decisions that persons may tend to make, there must be a recognition that these choices are not made in a vacuum. They are influenced by the socioeconomic environment. And even where we would have situations where interventions based on experience, they have been put forward as the best option, the best way to treat with things, sometimes it may not have the desired impact. The answer here may lie in what is the underlying assumptions of these interventions. Sometimes if we focus on cost-effective interventions, you may see a reduction in the overall burden of NCDs. But you may also see an increase, a widening in gaps, depending on how risk factors may be distributed in the population. A host of population-related differences. For example, if you have an intervention that targets persons in urban areas, the risk factors there may be very different to persons who may be in rural areas. So what we really need then is to have a full understanding of what drives persons' health behavior. What are the constraints of their circumstances? What can be done to motivate them to improve the choices that they make? Because essentially that's what a lot of these interventions are trying to do. Make people make the right decisions. So I'm realizing I may be running out of time a little bit. I just want to get to this. This is my final slide, by the way. I am advocating for more research. I know that we are a university, we're community, but there are certain questions that we still don't have answers to. Yes, we have data. Yes, on certain aspects, but in doing the research, you had certain questions that came up with regard to me. When we're talking about a basket of goods, for when we do household budgetary surveys, what about a healthy basket of goods? Is a healthy basket of goods affordable? What is the relationship between these determinants and non-communicable diseases in our countries? Are the risk factors different with persons in lower income groups as opposed to middle and high? How are these things distributed? Do we really have equality of opportunity in health? What are the roles of social determinants in prevention and control? All these types of questions are things that we need to know as we go forward. And I will just end there. Just bringing up some highlights there in terms of we have the research agenda for the Caribbean that was prepared by CHRC. We also have a research agenda for WHO, from the WHO. So there is room for us to learn more to get to the root of the issue of health behavior, non-communicable diseases, while at the same time having a focus on equity. Okay, thank you.